If you have or you're moving toward osteoarthritis, I want you to ask a question that most people I talk to are not asking. It's how do I prevent the progression of this? I'm Dr. Jeff Cumro, and over the past 15 years, I've been blessed to work with over 6,000 patients. And ultimately, it's you see a lot of patterns, right? With that, you see a lot of people that move in the same types of things. And no matter what you're doing, you see those same things. And what I see is a lot of people that have some sort of functional disability. Like they're not moving in as good, they're not moving as efficiently as they should be, is what I'm trying to say. And when we can start getting that efficiency back, you start to minimize some of the other stresses. If you can't get some of that efficiency back, then you continue to see the same patterns, and often you'll see the progression of those patterns, right? And so what I see a lot of people doing, they're not asking the question of how do I prevent this? They're saying it's just a process of aging. I'm just getting older. Everybody gets it with aging, and that's not true, right? Because we have people that do not get arthritis. Just because somebody in your family has had it, just because other people that you know have had it, that doesn't make it normal. It just makes it common. And so what are the things that we can do to actually move this forward? And recently a Nobel Prize was actually given for one of the mechanisms for osteoarthritis. I'm struggling to talk this morning, so bear with me. I'm going to try and draw, which is, as we all know, is an adventure as well. So, but it was given for the one of the pathologies of osteoarthritis. And what happens, it's called ferroptosis. You get mechanical stresses on the system, and it ends up causing iron toxicity. And ultimately, the pathway that goes through this is calcium. And all this is not real important. We're going to dive into the gist of it here in a moment. We're going to break it down so it's easy to understand. So, all right, so let's dive in here, and we'll kind of make a little drawing. And what we're going to look at here is you got a spine. We're just going to go like that. Call that a spine. We're going to make a couple of them here. And what we see a lot of times in the cervical spine, we see a lot of straightening. In the lumbar spine, we see too much curve. So just to give you, so you end up with this type of pattern. So what we end up with is these areas back here are actually jamming against each other. And when they start jamming against each other, that's a mechanical stress, right? It's things moving in ways they were not designed to move. If you have tight muscles from side to side, so if this is you, if you've got tight muscles over here, and you end up with weak muscles over here because these are overfiring in most cases, right? So it ends up pulling everything in this direction. That puts mechanical stresses on the system. It's a stress that the body's not designed to deal with, right? So as we start to get this, it puts different pressure on this. And ultimately what this leads to in the body is we start to get the release of calcium into these, that iron, that ferroptosis goes in and it breaks down some of the mitochondrial capacity, your ability to make energy as efficiently as you could. That ends to increase in inflammation is ultimately what we need to know from that, right? Inflammation we know is attached to that. That is the mechanism behind it. And when we get that inflammation in there, what we do is we release calcium. And the problem with this is calcium's an excitatory protein, right? Or an excitatory molecule, rather. So we start getting all this calcium built up. And, all these molecules start to just excite all of this stuff. And what I want you to think of as we go through this is, if you're a parent, have you ever had a party and you've got, a bunch of little kids? And after a while, you start looking more like that, right? You start getting a little bit more frustrated, You start getting a little burnt out when you have too many kids that are running everywhere and doing everything. It's a little overwhelming. It starts to burn you out. That is exactly what happens to the things that are exposed to this. And this happens in the brain with any kind of TBI, the traumatic brain injuries. It happens in the joints with mechanical stresses. It can happen in any nerve issue. I mean, there's so many things that this happens in throughout the body. And what we want to control is this right here. How many of these are released? And like I said, mechanical stresses play a big role in that. So what can we do to minimize mechanical stresses? First thing is getting adjustments, making sure those muscles are working as well as they should. When we can improve the functionality of those areas. And a lot of people think it's just, I'm going to go get cracked and it's going to feel better because I got cracked. No, it's restoring function in those areas. When we have proper movement, we take these abnormal stresses off of there and it starts to play a better role in what type of energy we release and what kind of molecules we release. But chiropractic is not just movement. That's something we've talked about as long as I've been making videos. We've talked about this. Chiropractic is not just movement. We also talk about diet. We talk about sleep. We talk about stress. We talk about all these other things because all of that plays a role in things like this. Our stress is ultimately what we're looking at with all this. It's not movement. It's not nutrition. It's stress on the system, right? All of those things comprise stress. So what can we do to counteract some of this dietarily? We can take in CoQ10. CoQ10 is something that helps the mitochondria function better. It's an energy transport molecule. And a lot of people look at this as a heart molecule. A lot of people that take statins need to be taking CoQ10 because it stops the cholesterol pathway before the production of CoQ10. If you knock down that ability to make energy, if you transport energy in this case, then you have other issues. CoQ10 has been shown to decrease this process that leads to the breakdown of that cartilage. It kills off those cartilage cells, which leads to osteoarthritis through that Piezo 1 platform. So when we start optimizing for our CoQ10 levels, that can decrease this. But we can also look at magnesium. Magnesium is a molecule that counteracts calcium. So ultimately, what I want you to look at this as is the excitatory function is like a bucket. And you got all your calcium in here. Magnesium is the little plug in here. So as you start to lose that magnesium, as that magnesium starts to go out of there, you start to get this calcium. I got to get my pen back. All this calcium starts to leak out into the system, and you end up with this type of thing. So if you don't have enough magnesium, and there's a lot of people that are magnesium deficient, it's not uncommon. And what I want you to think about here is not how much magnesium you have in your blood, right? A lot of times that's what's tested, right? They test the serum magnesium level. And the serum magnesium level can matter. It makes a difference. However, it's not the most important thing. What we need to look at is cellular magnesium. Because it doesn't matter what's in the blood. If you can't get it into the cell, it doesn't make any difference, right? So we got to look at the cellular magnesium, and there are tests that you can do to extrapolate that. Other things you can do. Fish oil, omega-3s, are anti-inflammatory. So they stop some of this process. They help with better energy production. They do all these different things. So a lot of this is not just the mechanical side of this. Yes, we have to have joint function, but we can also get this side of things, that diet. We can get that exercise thing right. Are you just doing weightlifting? Are you just doing running? Are you just doing swimming? If you're doing one motion over and over and over again, you're going to become dominant in certain muscles and you're going to become weak in others. So we've got to get more balance through that type of system as well. As we start getting these things to work better together, that's where we start decreasing mechanical stress. And when we start decreasing that mechanical stress, the system works better. We have better function, which is ultimately the goal of chiropractic care. And when you function better, we don't end up progressing into those things as quickly, at least. Does that mean you're not going to have them? No. There are other factors that come into this. I mean, there's immune factors that play into arthritis and different things like that. So there's a lot of factors. This is not an overarching view of everything. But if we can get these things right, it takes a ton of strain off of the body. It gets that function to where it needs to be to help you move forward in a more appropriate way. And when I say a more appropriate way, it doesn't mean what you're doing is wrong. It just means there's always ways we can improve upon things, right? So think about this. What area are you lacking? If you're not getting adjusted, it's something that makes a massive difference in all of this. You know, we can get the nutrition side right. If we still have spinal dysfunction, if we still have dysfunction in the joints, you're still going to have the mechanical stresses on them. And while this is going to counteract some of it, it's not going to counteract all of it rather. If we are just getting adjusted and we don't have the proper nutrients that we need to counteract some of that, that's a problem. So we've got to have all angles of this. If you're just doing weightlifting, you're not doing any mobility work. If you're just doing, exercise and you're not doing any recovery, we've got to have balance in this. So I hope that this helps you. As always, if you have questions on this, reach out. I love talking about this stuff, and I'd love to dive into your specific situation. Obviously, there are limitations on how much we can dive into. Most of this is educational in purposes. It's not, specific advice for each individual person, because I don't know what your scenario is. So that's something we can dive into if we need to. But as always, I love you guys. I appreciate your attention and your focus. I know are your greatest assets, and I appreciate you spending some of that with me. Hope you have a phenomenal week, and I'll catch you on next week's video.